I was just gonna say I have one more question, then I'll kind of leave you
Yeah.
guys. But I've seen some reading that some experts might suggest that people who are higher risk, like maybe diabetic, shouldn't get the vaccine, or they're not sure because they weren't in the initial tests of like the trials. And I just want to know what your thoughts on that. I think some people feel, well, then what's the point? Aren't they the people who need it the most? I guess what are your thoughts on that? Is that true? Should they not be getting it? What does that look like?
Yeah, so certainly many of these vaccine trials enroll people who are previously healthy or don't have a lot of medical illnesses. So for instance, in the vaccine trials that were done for COVID and for other viruses, they often don't include very young children or very elderly people or pregnant people or people who have other health problems. And so does that mean that you cannot use the vaccine in other populations? And the answer is no, it doesn't mean you can't use them. Individual judgment is required. You have to look at the risk benefit. Is this person a healthcare worker? Do they have other illnesses that if they get COVID could put them at, high risk of death? So if their immune system is weak, if their diabetes is very out of control, with having COVID, put them at risk for a very serious outcome. So you may have heard in the news that many pregnant people that work at some hospitals were refused vaccine because pregnant women were not included in the trials for vaccination. Mm-hmm. But does that mean that pregnant women cannot get the vaccine? The answer is no. That would be an individual decision. Now, I personally don't know whether vaccines should be given for COVID to pregnant women. But again, if it's being offered and to the general population and a pregnant woman wants to have it, that should be her own individual right to get the vaccine. But again, whether or not we don't understand perhaps vaccine safety in pregnancy very well with these vaccines. But as far as we know, there's nothing to suggest that women wouldn't benefit if pregnant. In my personal opinion, I would probably say that if you can avoid getting vaccinations in pregnancy, that would be great. But if a woman wants to have the vaccine, I don't think that request should be refused, especially if that person is a high risk of getting COVID.
Okay. Now, I know you have to run. Can you just give us some sort of glimmer of hope here, something to run away with in the future? Like, what are your projections of this whole thing? Do you think we're going to get through this? And how long do you think it's going to take before we're back to some sort of normal life? Or is this normal life going to be our normal life from now on?
Yeah, I mean, I hope this isn't normal life from now on. I don't think any of us know how long this pandemic is going to last and when it's going to go away. I do believe that things will eventually get better. We may have bumps on the road, if you want to put it that way. Winter season is usually a season where there's a lot of transmission of respiratory viruses. A lot of this is related to being indoors during cold weather. But certainly with the bubbles that we form with our families and perhaps with our work colleagues, I guess, and with a greater emphasis on social distancing and personal protective equipment, I think that we will get through this. The vaccines, I don't think will have much of an impact early on, but I think they will eventually if the pandemic drags on for a lot longer. The lockdowns, I'm not sure that the lockdowns will have any significant impact overall. And the lockdowns, as we discussed earlier, they have to be more vigorous, and they need to incorporate restrictions on international travel to a very high degree. Can't have leakage of international travelers into the country who are not monitored if you're going to have a lockdown for your own residents. So I don't think that the lockdowns being implemented by the government here in Ontario or in Canada or elsewhere in other jurisdictions have worked, except for island nations like Australia, where international travel was really restricted, and the requirement for people who are coming in as international travelers was a lot stricter than it is, for instance, in Canada.